When conflict tore her community apart, Sarah, a girl mother, found safety in a camp for displaced people. One morning, while other children were at school, a camp manager noticed Sarah and her baby begging. The camp manager quickly and safely referred her to one of the child protection focal points working in the camp, who soon noticed Sarah wasn't the only one. Other girls with small children were also begging. This information was shared with the Child Protection Cluster Coordinator, who had already received similar reports from others. After discussing this concerning trend at a Child Protection Coordination group meeting, they decided to collaborate with other sectors that could help. What steps did they take? Due to a lack of information, it was agreed that a rapid intersectoral assessment was needed. Actors from child protection, gender-based violence, food security and livelihoods, and nutrition coordination groups developed the assessment questionnaire together. It included questions about girl mothers' access to essential items and services and the safe storage and preparation of food for their children. It also covered safety risks, their mental health and well-being, and the availability of educational and livelihood opportunities. Once the assessment was completed, the sectors jointly analyzed the responses. It turned out girl mothers faced several barriers in providing for themselves and their babies. For instance, they were often harassed on their way to clinics. Many girl mothers did not know how to store food safely or make sure that babies and young children had a balanced diet. Some felt they were judged and had few trusted places to get support. And while they wanted either formal or non-formal vocational training, most programs only targeted those 18 years and above, and there was no one available to help take care of their children. Using this analysis, actors from several sectors identified ways they could work together better to improve the situation for girl mothers like Sarah. All sectors agreed to monitor girls' access to services, with child protection and camp coordination and camp management making sure girls' voices, needs, and preferences were heard. Their collective actions included organizing baby-friendly spaces where young mothers could receive useful information on early child development and nutrition, including safe food storage and preparation for their babies, vaccinations, and other important messages. These spaces enabled young mothers to share any concerns safely and also meet other mothers. Child protection caseworkers were also available at nutrition centers to offer parenting sessions and facilitate easier access to individual and group mental health and psychosocial support. The girl mothers were supported to enroll in non-formal education and vocational training tailored to their age. Education and child protection actors also helped the girls access nearby early childhood development centers or other safe childcare options so they could attend classes and trainings. Over time, monitoring and evaluation found that the well-being of not only girl mothers and their babies improved, but also that of other young mothers. Good practices and lessons learned from these joint initiatives were documented and shared widely with actors in other settings. Most importantly, Sarah and her baby were safe, healthy, and their basic needs were met. When we work together across sectors, we can do more to ensure the safety, well-being, and protection of children like Sarah and her baby, leaving no one behind.